All right, everyone, we are going to go ahead and get started here. I'm sure folks will continue to join, but we are going to proceed. Welcome to the Digestive Health Talk Live with Dr. Shadi Sarebanha. It is truly my pleasure to introduce her. She is a naturopathic physician for adults and children, and is amazing. Will be presenting for us today. Her area of focus include pediatrics, women's health, autoimmune conditions, thyroid issues, digestive health, of course, which we're here for today, anxiety, mental health, weight management, skin health, and more. Dr. Shari Saraban has a very impressive background. She is a distinguished naturopathic physician who embarked on her journey into holistic health with a solid foundation in Western medicine, first actually earning a medical degree in Iran. She then took a transformative trip to China, which marked a turning point in her career. Dr. Sarebanha pursued a PhD in Chinese medicine, immersing herself in ancient modalities like acupuncture and herbal medicine. Building on this, she expanded her horizons by achieving a doctorate degree in naturopathic medicine. Obviously, with a profound knowledge in both Western and alternative medicine, Dr. Sarebanha really bridges these two worlds. Her unique ability to fuse these modalities into a comprehensive approach to healing for her patients. Further, Dr. Sarebanha is fluent in English, Mandarin, and Persian languages, very impressive. And she considers it a privilege and also a strength to communicate with patients in their native language. Dr. Sarebanha wishes to guide all of her patients and empower them to discover the best version of themselves so they really can experience optimal health. Topics today will discuss irritable bowel syndrome, SIBO, and the gut-brain connection, and attendees will have the opportunity to ask questions after the presentation. We'll ask all questions be held, but after that presentation, we will open that up to questions, and folks can use the raise hand feature. Feel free to reach out to me if you need anything after the call or in the chat. I am here, and we're very excited. And I'm going to go ahead and turn it over to the lovely Dr. Sarebanha.
Okay, good afternoon, everyone, and thank you, Angela, for your great introduction. So welcome, everyone, and thanks for joining us today in the naturopathy talk, mostly about the gastrointestinal health. So I want to say Happy New Year to those who I see them for the first time in this year. So that's a great opportunity that we have this 1 hour to talk about naturopathy and gastrointestinal health. And then at the end, if you have any question, I will be happy to go over those one and answer those questions. So I have prepared kind of like a PowerPoints to make it more consistent. So you can follow those one. And as Angela mentioned, mostly I will go over the gastrointestinal disease today. So I think Angela mentioned the mission. So my mission is always to guide and empower the patients to unlock the best version of themselves in order to experience the optimal health. I think everyone deserves to feel normal, deserve to feel healthy, even though there are some underlying issue like genetic, for example, which may not be on our hands, but still we can do something to make it better. So I start the lecture by talking about the core principles of naturopathic medicine, which I mainly apply in my practice for helping my patients in like daily basis. So the first one is like the holistic approach, which is treating the whole person, not just the symptoms. So mostly people are coming to see me, they are saying like, I have cough, I have this, I have that, but like the doctors are mainly just treating the symptom. I need to know what is the root cause, right? So here I believe that the true well-being comes when the whole person is healthy. So mind, body, spirit, and the soul, heart, everything should be in harmony in order to feel happy, right? So, and healthy. So the next one is the root cause identification. So sometimes patients are coming with chronic cough, but they don't know that cough is just because of the stomach acid reflux, for example, right? So if we just treat the cough, it's not really treating the disease itself, right? So cough is a symptom, but we need to know what is causing that cough, right? Or the patient is coming with migraine headache. One patient with migraine headache is different from the other patient with migraine headache, or one patient with IBS is different from the other patient with IBS. So we need to know what is causing IBS for patient A compared to patient B. And always, doctor as a teacher. I'm glad that I'm part of the part-time faculty at VUIM, and I have been involved in teaching since 2009, which keep my knowledge up to date always, and I can use that part in my practice when I educate my patient for prevention. So sometimes it's really important to prevent rather than start the treatment, like prevent of cardiovascular disease, because sometimes when the disease is happening is too late, right? So this is the other approach that I really like to apply in my practice and to emphasize on prevention and health promotion. I do have many patients who are coming and they said that I want to be healthier. That's it. So there is not really a chief complaint, but they want to get the best of their health and see where they are. The other principle in naturopathic medicine we have is individualized treatment, as I said. So if a patient is coming with a gastroesophageal reflux disease, the cause could be low acid or the cause could be high acid in the stomach. So it's really important for me to see which patient do I have right now in front of me, right? So not everyone with reflux is having the same reason or the same etiology. So that's why I try to tailor the therapy based on the patient's need, based on the root cause of the disease. For diagnosis approach in naturopathy medicine, again, it's just a comprehensive assessment. So if the patient is coming with abdominal pain, or if the patient is coming with nausea, vomiting, or cough, or even depression, I will do a very thorough assessment for diagnosing the case, right? So it could include evaluation of physical exam, mental assessment, emotional assessment, environmental factors, because this is the holistic analysis. And I always mention this one in the first session to my patient, that the history intake may take about an hour or even more. So just bear with me if you see that I'm asking more questions, which is not to you, may not be relevant to the case, but it's helping me to diagnose your condition. So always I ask for their lifestyle, diet, exercise, sleep, stress, energy, even bowel movement. Even the case is for depression, for example, for anxiety, but still I need to know more for the totality of the symptom. And the reason I chose gastrointestinal system today is when a person is healthy in gut, is not just the gut, is well-being, right, for the overall health. Today we will talk about the connection between the gut and the brain that we have, the connection between the gut and immune system. So it's it's not just gastrointestinal system, it's way beyond that one. So we will talk about that shortly, but just wanted to go over the naturopathic approach that I apply in my practice for whatever condition is, but then more specifically for GI today. So the mind-body connection, as I said, so I will assess the mental health for almost every patient. Environmental influences, like the places that they work, because sometimes if there is any toxicity exposure, people who are working at gas station, for example, or people who are working with toxic environment in general. So I may need to do a little bit more evaluation when I want to check and diagnose them for diseases. The other one is like the diagnostic approach also should be patient centered. So it's like if the patient is saying like, I have done this, I have done that before, but I need your help to tell me what is the root cause of the disease. I have to listen to the patient. So listening is one of the art that physicians should have it. Just let the patient talk, let me know what they are looking for, and then with plus my experience and knowledge, then I can walk them through the diagnostic tools that I have. After interrogation, like asking a bunch of questions, doing a physical exam, then we come to the lab test, which one of them is just a general lab, like most of the lab that we done through LabCorp or similar laboratories. And then we do have some more specific one like urine test, saliva, or stool analysis. And also the one that makes it a little bit different from conventional medicine is functional testing, which is a deep dive in biochemistry and body function. And it can tell me exactly what is wrong with the biochemistry in the patient. So personally, I don't like to throw supplements to patients, like tell them that you need to take vitamin B because it's good for your health. You need to take vitamin D because it's needed. You need to take vitamin C because it's antioxidant. I prefer to do some testing to see if it's really needed and then provide it to patient, because it's an extra work for your body, especially for your liver, to get rid of those even vitamins, right? So that's why I know it's costly. The functional testing is expensive, but I think it worth to do it because it tells you specifically your needs, right? So it can help you to understand if your body is more toward the oxidation pathway and you need to support it with some antioxidant, right? Or your body needs more cofactors like B vitamins or magnesium to get through the conditions that you are suffering from. Many people, they don't know why there are some inflammation in their body or why there are some mitochondrial issue in the body, but the problem is just the cofactors which is needed for those pathways. So when we do those functional medicine testing, it's kind of a help for me to understand my patient better in deeper aspect. And then for the treatment is huge, right? So based on my training from Western medicine, Chinese medicine, naturopathy medicine, I try to choose the best for my patients. So if it's needed, I can refer them to their surgeon or gynecologist or pulmonologist as needed. But then lifestyle changes, diet, supplement, nutrition, and physical therapy, many modalities that we have, like Chinese medicine, pulse and tongue, that would be the main part of the treatment based on the patient chief complaint and also the test results. But always, as I said before, don't forget about prevention. Prevention is better than cure and treatment. And the next part is like sometimes when a person is coming and we talk about the condition, they go and they are not thinking about the follow-ups, right? I believe the ongoing assessment is as important as the management of the condition, because sometimes we need to adjust the dose of medication, sometimes we need to change that one, right? So it's always important to have it like for a patient who is coming for SIBO, for example. SIBO is not a condition that I can cure it in a day or two. No, SIBO is a chronic condition, so the treatment is like 4 to 6 months, sometimes it may take. And then after that, when I may ask patient to come for follow-up, see where we are and how should we support the gastrointestinal system. So having said those parts for general approach for naturopathy treatment, and we are here for the GI, gastrointestinal health. So I know we don't have a huge amount of time, but it's enough. Like I can go over the importance of the gastrointestinal system and see what we can do in order to make ourselves like feel better in this only one system. We know we have 11 systems in the body, but like gastrointestinal is one of them, which can almost cover many of the other systems that we have in the body. So when we talk about gastrointestinal system, is starting from oral cavity all the way to the anus. So any organ, it get damage in this pathway, including like stomach, esophagus, large intestine, small intestine, even liver as an accessory organ, or pancreas, gallbladder. They are still part of the GI system. But again, there is no time to talk about every diseases in GI system. So that's why I chose the most common one that people are coming for. One is the SIBO, the other one is IBS. And also I want to talk about the gut-brain relationship as well. So microbiome, which I'm pretty sure most of you have heard about that one. So we do have such a great number of good bacteria that they are living in the gastrointestinal system. And it's interesting to know that the number of the bacteria that they are living in the GI system is 10 times of the cells that we have in the body. So they are significant, right? So why should not we pay attention to them, right? So that's one of the part that usually people forget about it. Like they take antibiotics for life, and they are not thinking about like how antibiotic can affect on microbiome. So that's one of the part that we will talk about, and the effect of the microbiome on immune system, the effect of the microbiome on mental health, right? This is actually a hot topic now for researchers, that they are thinking about many of autoimmune conditions now are linked to microbiome. Like, I don't know if you guys know ankylosing spondylitis, for example. It's one of the autoimmune condition that it's linked to microbiome changes, or rheumatoid arthritis. I'm pretty sure most of you have heard about that. Rheumatoid arthritis is also related to microbiome changes, or IBD, like inflammatory bowel disease, ulcerative colitis, Crohn's disease. They are linked to microbiome. So that's why it's really important to work on the microbiome to make sure that we are having a healthy group of bacteria in GI system. So here I just listed common kind of like couple of the diseases that we have in gastrointestinal disease, but again, I will go over a couple of them, but if you have any question for the one that I'm not covering, feel free to ask me at the end. So we do have IBS and SIBO, and then I will talk about the brain and gut connection. So the irritable bowel syndrome, probably you guys have heard about that one a lot. People are suffering from that to the extent that it sometimes is really debilitating, and patient is in pain. Sometimes the symptoms are not that much severe, and patient can manage that one somehow. The symptoms are not very characteristic or pathognomonic for this disease. The symptoms that we see here can be seen in many different conditions, but the most common one is like the abdominal pain and the alternate bowel movement. So it could be constipation, it could be diarrhea. So some people are more prone to constipation, some people are more prone to diarrhea. And there are some factors that we are considering those one as contributing factors to IBS. One is diet, the other one is stress, and the other one is gut microbiome imbalances. So the change in the gut microbiome is not just for the abdominal pain symptoms, it's also caused the symptom that a patient with IBS may feel anxious, may feel depressed, may feel more sensitive to pain, right? And these are all just because of the microbiome, which are affecting the neurotransmitter secretion in the gut. So that is one of the main part that people with IBS are seeking medical attention, not just for the GI symptom, but also for some of extra gastrointestinal symptom. So the two hypotheses we have for IBS, which I try to address that one in my practice, one is dysbiosis and the other one is immune activation hypothesis for IBS. So when we talk about dysbiosis, means that the good amount of the bacteria that we should have in gastrointestinal system is changed. Either it has increased to the pathogenic one or decreased to the beneficial one. So in order to have a healthy microbiome, we should increase the number of the beneficial microbiome, the bacteria, but not the pathogen. So when we are taking antibiotics, what is happening? It's killing all the good bacteria, and that good bacteria and bad bacteria together. And that's why the patient will become more prone to get the opportunity for bad bacteria to come in, and then they can have like diarrhea caused by antibiotic use, right? So when I want to address this one, I tell patient that if we have any dysbiosis, it may cause intestinal inflammation, that we have it for people with IBD, inflammatory bowel disease, or when we do have dysbiosis, it may cause increased gut permeability, right? So those people are, when I do food sensitivity, the result come back and the patient is sensitive to 100 foods. Are they really sensitive to those much of food? Not really. It's just because of the permeability. So it's not sensitivity. So this is the time that I tell them that, okay, we need to heal the gut, because it's because of that dysbiosis, we have a lot of like permeability and a lot of like inflammation going on. Motility will change with IBS. So there are some abnormal gut motility in people that they have dysbiosis. So probably, you know, like SIBO, small intestine bacterial overgrowth, those people usually they have low motility. And that's why they have gas and bloating. And the gas and bloating is more in the upper part of the abdomen, which is the small intestine. And that's because of the dysbiosis that they have. The immune activation, a significant amount of immune system, like the immune cells that we have, they are living in digestive system. So I have had many people that the chief complaint is I get sick frequently. I have cold most of the time during the winter, but they don't know about their GI. The we have to is not just boosting or working on respiratory system to get rid of the cold and infection. No, we have to work on the GI system sometimes. So that's what I mentioned, a root cause, right? So because the immune system, most of the immune cells are residing in GI system. So if we have any abnormal immune response, it may cause different manifestation. One of them, it's believed that for people with IBS, we do have that abnormal immune response because of like microbiome has changed, then the immune system is changing, then they are having some sort of like symptoms in people. So that's why they have low-grade inflammation in gut. For treatment, again, we need to know what is the cause, right? But then we approach through different ways. Like, for example, I mentioned the case of food sensitivity test, and then I see a lot of like food are coming back sensitive. So this is permeability. So for me, I don't need to give them probiotic at the moment because the gastrointestinal wall is not working. I have to heal the gut first, and then start to back up the bacteria, right? So it really needs to know, I need to know what is the cause and then start doing the treatment. So if you ask me, is probiotics good to be taken all the time? The answer is no, because we need to know where we are, right? So we need to know if we have a good growth of bacteria or if we have like dysbiosis. And the best way to know that one is a comprehensive stool analysis test that we do. And we understand that one. Then we can apply some dietary or lifestyle changes. For sure, stress management, some herbal remedies that can help with healing the gut. We can use that one as well. and treat the IBS. So again, IBS is not a disease that happened overnight, and we cannot do the treatment just by doing a treatment for a day or two. No, it's something that we have to bear with the disease, and then do step by step the treatment, like healing the gut and then replacing the good bacteria. Same thing with SIBO. SIBO, when I was in med school, to be honest, we didn't have this word in textbook. Like SIBO came back later on. SIBO is the small intestine bacterial overgrowth. So is, and the main reason that the patient with SIBO usually comes with the gas and bloating, which is on the upper part of the abdomen, which is because the problem is that we have overgrowth of bacteria in small intestine. However, we do have large intestine overgrowth of bacteria as well, but SIBO is more common because most of the bacteria that we have are living anyway in large intestine, right? So that's why SIBO is more considered to be pathology. So SIBO can be kind of like caused by some underlying pathology, like people that they have diabetes. The reason is because diabetes can cause gastroparesis, which is like weakness of the movement of stomach muscles. So anything that is reducing the motility, like hypothyroidism, for example, or surgery, or many different things can cause SIBO. So that's why, again, for SIBO, if a person is having SIBO, I need to know what is the cause. I may check them for hypothyroidism. I may check them for like motility movement and many things like medication sometimes to see what is the cause. So for diagnosis, mainly clinical evaluations, physical history taking, and also for sure lab tests. So there is a hydrogen and methane breath test that we do, and based on that one, we can see the SIBO. And there are some other tests like in Genova laboratory, they run a test for stool test. But it's kind of like telling us if the patient is prone to SIBO or not. It's not confirmatory diagnosis though. But if I do stool analysis for something else and then I see those markers, I may refer patient to do some other test to see if the patient is really having SIBO. So this funny picture is showing us like what's going on. It's too many bacteria, not necessarily the good one. So that's why we call it overgrowth, right? And the treatment of that one for SIBO is long and chronic. So usually in my practice, I have two phases of treatment, because first we need to change some of the diet and lifestyle and heal the gut first, and then introduce them to some good bacteria and supplements to balance those microbiome, right? Plus some of the herbal remedies and some of the supplements like oregano oil, for example, berberine. But again, these are just for information. It's not for personal use. We need to know what is the cause, what is the best treatment, and then what is the best approach for SIBO. So if you ask me, is probiotic good for SIBO or not? At the end, if I want to give you just one answer, the answer is no. But if I want to give you a more detailed answer, is yes. So what does it mean? It depends on which phase of SIBO we are, right? Because if you give probiotic to a patient with SIBO, what is probiotic? Probiotic is a bacteria, right? We give it to a person who already have a bunch of bacteria, right? So we are making the situation even worse, right? So that's why I said not necessarily at the beginning. That's why we are not giving probiotic to them, but it's needed during some phase of the treatment. So I have to I have to heal the gut. I have to bring back the healing, the barrier to the gastrointestinal wall. And then like, if I need to do any kind of like stress reduction, lifestyle changes, or many different things, I'm pretty sure that the small intestine is okay. Now is time for working on the microbiome. Just quickly go over the gut-brain connection, which I really like this part, because many patients with depression, with anxiety, with dementia, they are coming, but they don't know that the underlying cause is the GI system. So I like this picture, how it's connecting the GI to the brain. So it's interesting to know that about 90% of the serotonin, which is the happy hormone, is produced and is in our gastrointestinal system. So serotonin, it's a hormone, it's a neurotransmitter, which is needed for conducting a lot of like chemical reaction between the neurons and let the other neuron know what to do, right? So this is the main function of a neurotransmitter. But serotonin specifically is the one that we have for happiness, right? So that's why many people with depression, they are taking SSRI medication like Prozac, for example, right? Because Prozac is inhibiting the uptake of serotonin. So serotonin will be there more and they feel happy after, right? So that's one of the treatment, medication. But why not we treat the gut? Because the gut is producing a bunch of those serotonin, right? So when we are giving the probiotic, for example, it's going to modulate the gut microbiome, right? It's going to balance the essentials for the body. But again, do we need to give probiotics to everyone? The answer is no. We need to know where we are and what strain of probiotics we need to give, right? Because different probiotics, like the brands and strains, they are having different types of bacteria. So that's why sometimes we need to give prebiotics or sometimes we need to give the probiotics, right? So this is just in general. I'm talking about the role in general for probiotics in mental health. Neurotransmitter production, some certain types of probiotics also shown that they are able to produce a specific type of neurotransmitter, including serotonin and GABA. GABA is gamma aminobutyric acid, which is one of the hormones which is helping with sleep. So sometimes it's like coming down the mind and brain. So sometimes a person with gas and bloating, diarrhea or constipation, IBS or SIBO, they are having insomnia as well, right? So this is the way that when you treat the whole person, when you are working on the microbiome, then you are addressing the insomnia at the same time. So you don't need to give them sleep aid, right? You can give them, but it's just symptom treatment. That's why I prefer to know, okay, if I put all the symptoms together, most of the time, like 90% of the time, we are able to conclude that what is the root cause. The other one of the probiotics, as I said, is the role in inflammation. So I mentioned that one for rheumatoid arthritis, for irritable bowel disease, not irritable, the inflammatory bowel disease like Crohn and ulcerative colitis, for ankylosing spondylitis, if you have heard about those diseases. Nowadays, scientists are thinking about microbiome change as a cause for those diseases, right? Like MS, multiple sclerosis is the other one that they are thinking about microbiome. It's not like really antibodies or something, even if there is an antibody related, but it's because of the change in microbiome, which play a role in inflammation. So sometimes as an anti-inflammatory medication, I may give my patient probiotics, right? So that makes sense now. That why we need to give probiotics, because it's reducing inflammation, preventing systemic inflammation, right? Some people with systemic inflammation means what? They come with dementia. They may come with Alzheimer's disease. They may come with different manifestation, but the problem is just inflammation, right? Like Alzheimer is called, like recently in textbook, they are adding inflammation as one of the causes for Alzheimer's disease. So where does that inflammation comes from? Many different areas, but one of them is the gut, right? So that's why we need to address the gastrointestinal system. Immune system, I think I talked about that one earlier, the effect of gastrointestinal system on immune. So like the immune system may contribute to the general health and also the potentially some of this like the responses of patient to stress, like anxiety, cognitive impairment. So bottom line is me as a naturopath physician with a background in Chinese and Western medicine try to heal the gut naturally, right? So through the different methods like supplements, herbs, some essential fatty acids, probiotics, sometimes collagen. It depends, right? So we do have many different supplements. Most importantly, we have to check lifestyle, right? So making sure that the patient is taking a lot of like fibers, low sugar because of inflammation, not much processed food. I mean, like the whole food, as I said, high fiber, I mentioned that one. And that was my tip for New Year, mindful eating, right? So be mindful about your eating. I was reading an article that was talking about a food which is high in cholesterol. If you feel like that cholesterol is going to be bad for you, actually it's going to be turned to a bad cholesterol. But if you think that cholesterol is going to help you to produce some hormones which they need cholesterol, actually they will turn to a good cholesterol. So I'm not saying that it's 100% accurate or not accurate, but we can take the lesson from that, that if you feel happy, eat. If you don't feel happy, don't eat. It's just because that when emotion will affect on your body, right? So if you are not mindful, some people are just eating while they are driving, they are eating while they are watching TV, right? So this is not the mindful eating. And stress reduction for sure. And as a conclusion, in order to have a healthy gut, which I believe is not just gut, it's like the general overall well-being. When you have a healthy gut, you have to pay attention to many different things. It's not just your diet. Diet is the main part, but also your stress, your hydration, your sleep, your lifestyle, your microbiome, and all together. I hope everyone stay healthy and pay more attention to the gut health from now on. So again, thank you for listening. And I hope I was able to conduct the gist of the part for the gastrointestinal system to you guys. And I'm happy to hear if you have any questions.
And folks, just remember there is a raise hand feature down in more or your reactions. You can go ahead and raise your hand if you have any questions. And Dr. Sarebanha is talking for informational purposes only. So she is speaking in general terms and not giving out dispensing medical treatment.
Exactly.
Mm-hmm.
Yes, Rita, go ahead.
I have a couple of questions. What is the slow motility? Is that where the stomach muscles aren't really working to move food, and your food might be building up in your stomach, or what is actually slow?
Exactly. So we do have a movement which is called peristaltism, which is a movement like forward movement, which is pushing food down all the way to the end of the gastrointestinal system. So the person is having a slow motility. That could has many different reasons, but then yes, it makes food to be more available for bacteria, that they do fermentation, and that's why it causes like gas and bloating for patient.
Well, can that cause, regurgitation? Because that is something that.
Question. Yes, it can cause, because the stomach has a limited capacity, right? So when we go over that one, then it may cause the stomach contents go rejected backward, and this is the time we have reflux. It's not the common cause, but it's very similar to the time that the person has constipation, right? So when abdominal pressure go high, the patient might have regurgitation. So that is a cause, yes.
Thank you.
Yeah, you're welcome. I see another raised hand, D. So go ahead, please. D, are you here?
If so, you can go ahead and just unmute yourself if you had a question, Dee. We see your hand raised here.
Can you hear me?
Yes.
We got you.
Okay, excellent. Thank you so much. And D stands for David, for what it's worth. Okay, I wanted to ask you first about food and get your thoughts about these foods to help with leaky gut. One is bone broth, which I know contains collagen. Another is miso soup, which I know is fermented. And then root vegetables, I heard, is good if you rotate them. It's because the good guys like it, but the bad guys don't. And then in general, fermented vegetables. I wanted to get your thoughts on those things as far as food to help the leaky gut.
Perfect. That was a long list. So I try to remember those four.
You want me to repeat it?
That's okay. I think it's in my mind now. So the fermented vegetables that you mentioned and the miso, they are good. But again, we have to heal the gut first before we introduce the fermented food. So the first one, I think it was bone broth that you
Bone
mentioned.
broth.
Collagen. Yes, I agree with that one as a first line of treatment. And we do have like glycine amino acid. If you search, you can find like glycine amino acid is good for collagen and also all of those healing the gut barriers. So I think all of those one that you mentioned, they are effective, but it depends on which phase of the treatment we introduce those to
Sure.
patients.
The other one was root vegetables, which I was told the good guys like, but the bad guys don't.
You said fruit and vegetable?
No, root vegetables like turnips, like rutabaga.
I see. Okay. The root vegetables, yes, is okay. It's okay in general. Yeah.
Okay, and then the second question I had concerns actual ingredients, and I know it depends on the phase that you're in, but I've heard glutamine, citrus pectin, deglycerized licorice, aloe vera extract, slippery elm, marshmallow, MSM, and okra extract. And I know that's a lot, and that formulation is part of Designs for Health GI Revive, but I've heard other formulations like that to help with leaky gut. I was curious to know your overall impression of those ingredients.
Yes, I'm familiar with GI Revive. That is one of my favorite supplement, but not for everyone. For example, because of the licorice, I don't suggest that for people that they have hypertension, right? So that's why I really need to know the patient underlying condition in order to check with every ingredient on that supplements to say if this is the best for them or not. Like slippery elm is good, but I never give it to children with IBS because it may cause appetite to go away and they are not eating the nutrient that they really need to take it, right? So in general, it's a good supplement, but not for everyone.
Okay, and then finally, do you test for environmental toxins like heavy metals and
Yes.
other kinds of environmental toxins and treat it with binders or chelators to help reduce the environmental toxin levels that are in your body? And is that related to gut health?
Yes, we do test for heavy metals and environmental toxicity. It's we do have a standalone test, and also we have another test that does everything together. And for the treatment, we do have the one that is in the scope of practice for naturopath physicians. So like ETA, for example, we don't use that, but we do have some other treatment that we use for heavy
Yeah,
metals.
I heard mycotoxins also could be an issue.
Yes, exactly. We do have a urine test that check for mycotoxins.
All right, thank you so much.
You're welcome. And Terry, I see your raise was up there for quite a long time. Go ahead.
I've been dealing with GI problems for years, and my doctor finally told me this last time to fix my brain and suggested something called limbic system retraining. And I was wondering if you've ever heard of that and what your thoughts are.
So the initial issue was gut or brain?
Gut. I have gut problems that won't go away. Irritable bowel. I've had SIBO off and on. I have slow motility. I think I have hypermobility, which means my muscle tone is not great. So I think I need help with motility sometimes. But this last visit, he said to start working on my brain. And I went back into counseling, and that's helped a little, but they want me to do limbic system retraining. It's something like it's DNRS. I haven't done a whole lot of research yet. Annie Hopper's program. I was just wondering if when you talked about the gut-brain connection. Are you talking about and stress management? Is stress management like limbic system retraining?
Right, right. Okay, good. The DNRS that you mentioned stands for Dynamic Neural Retraining System. This is something that, to be honest, I don't work with that too much, but I have heard about that when it's kind of like visualization or cognitive restructuring, mindfulness, or so it's not like a medication or so. It's more kind of like working on the limbic, as you said, the limbic part of the picture. So
Okay.
my approach will be first on gut and microbiome, and then if it's not working, then I switch, because I believe it's from gut to brain, not the other, like the brain to.
Okay. Okay. So I still need to work on the gut because I still have dysbiosis and leaky. Yeah. Okay. I need to work on the gut more then. Okay. Thank you very much.
And
Thank you. And it looks like Dr. Sarebanha, we have 2 more hands raised, and then we have 2 questions in the chat as well.
okay, yes, Rhonda, go ahead.
If you can see those, or otherwise I can go ahead and read those.
Yes, I am here now. Okay. So Rhonda, go ahead. You can unmute yourself. No? Okay, so let me go to the next. Amy?
Hi, Dr. Sarebanha. You've been working with my daughter Agustina, and she's doing very well, much better. So for anybody listening, Dr. Sarebanha is an excellent physician. Appreciate that. I'm actually listening in for myself. I've had over my lifetime issues with syncope, passing out. At different times, it'll be maybe I'm low on sleep or very hot, maybe a hormonal thing. It's not something that any doctor's been able to figure out. And I'm wondering if it's even related to some food I've eaten and an allergic reaction or something.
So Amy, that's something.
Yeah. Go ahead.
Is that something new for you?
No, it started when I was a teenager, and I recently had one over Christmas time, which made me think I probably need to come in and talk to you about, someone told me maybe it was low blood sugar or just low blood pressure during stressful situations. But I'm wondering if it's even like a gut issue, because if it comes after certain foods or, like after coconut water or something that flushes my system or things like that.
So based on the history that I know from you guys, it doesn't seem to be the gut issue, but I will be happy to go over that one. I believe
Okay.
endocrine part.
Okay. Thanks.
And so there was a question about how does breastfeeding impact your gut issues. So can you, maybe I'm not getting the question, the breastfeeding effect on mom or the breastfeeding for like the breast milk for the child microbiome?
On mom.
Oh, okay, the mom. Oh, this is something I have never heard, like, or how breastfeeding will change the gut microbiome for mom, right? Is this something that you have heard about, or?
No, I was just curious if breastfeeding impacts any of the talking points that you brought up.
And I know that the breastfeeding, because there are some brain involvement in production of the milk and ejection of the milk, yes, but it may affect on the diversity of the microbiome, but probably is in a good way. But to be honest, I have no idea if it's going to be like a cause or something for dysbiosis or some like a condition. No, I have no idea. But in general, I know that the breastfeeding, because of the involvement of the brain and also weight management, like not directly, but indirectly, is acting on diversity of the microbiome.
Thank you.
Yeah, you're welcome. There is another question. Thanks. Yes, go ahead.
Doctor, sorry, this is Rhonda. I was for some reason unable to unmute, and now I can. Can I ask my question quickly? Is it still okay?
Go ahead.
Yeah, I have a question about oatmeal. So oatmeal has been a staple in my diet for a really long time. And I just read something saying that it's not particularly, even if you're getting it you know, organic, gluten-free. It's not good for you to have it because if you have leaky gut. Is that true? I was just wondering if you could speak a little bit about that.
Like the oatmeal for leaky gut.
Yes, ma'am.
Have you done the food sensitivity test?
No, I'm not.
Okay. So if that, I'm not saying, this is again my approach. I'm not saying egg is good for everyone, egg is bad for everyone. Egg is good for someone, egg is bad for someone. So oatmeal could be good for you, could not be good for you. I need to see the food sensitivity and see if you have the leaky gut really, right? So one of them is because when we do food sensitivity, it come back as 3 groups, right? One is high, moderate, low. And I want to see where is the oatmeal for you, right? But in general, especially if it's like gluten-free, I don't see any problem with that because like the glutamine can be used as one of the supplements that we use for healing the gut. So is that the answer or no?
Thank you.
Welcome. There was another question in the chat. Burping, yeah, not much constipation, blood work, and sorry, I'm just reading. Do you want me to directly reply to your question, or is that okay if I answer but not saying the name?
You can say my name. Sorry, I'm just in a public space, so I didn't want to ask this super loud.
So the blood work, gluten or dairy, not gluten, dairy, nausea over the time, a supplement that doesn't seem working, what should I do? Okay. So when you have those kind of like condition, and I'm not sure what tests you had done so far, like have you done like food sensitivity? Have you done some other special like functional testing? But I believe you have to check for H. pylori and also for GERD. So sometimes those symptoms are GERD, it's the gastroesophageal reflux disease. So I think we need to check those one to see if, oh, okay. You mentioned that the GI doctor says something about H. pylori. So that's exactly what I was referring to. Yeah.
Okay, so the supplements that I've been taking, I've had like 7 and I haven't seen like so much of a difference. Or is there something
So
else that
there is something underlying, yes. And Lean is asking for remotility, for colonoscopy, and I had flaccid, okay, colon, lifelong constipation. I have used many supplements to promote anything else that can be done due to the structure. So you answer your question, right? It's a structural issue, right? So just you have to work on your diet and lifestyle. So more, I recommend acupuncture and more lifestyle changes, exercise, and some abdominal massage to help to move the large intestine.
It looks like we just have one more in the chat here, which is great because we are running out of time, which was, thank you, Dr. Sarebanha. What is your general opinion in terms of benefits or not of colon hydrotherapy?
Yes, colon hydrotherapy. Okay, again, it depends on the case, really. So sometimes for cases that they have like low motility, I agree more. But for the other cases that they are able to evacuate the large intestine, I'm not a fan of like doing the high colon hydrotherapy a lot. So in general, I want to say like not more toward doing it, you know, for general population, but it's indicated for someone. And Rita, I think you raise your hand again, right? Or it's just from before?
No, I raised my hand again. If okay, this is about a symptom. If
Yes.
you have, if it sounds like a gurgling brook in your abdomen, what could that be on the right side, like a gurgling brook?
This is hard. So I cannot answer just by having one feeling or sensation, right? So I need to know the patient, how old is the patient, like what are the other symptoms, what are the underlying diseases that the patient might have. But as you mentioned in the right side, how severe is that one? Is that every day? Like a lot of questions I need to ask in order to answer your question. But it's like to be more with the gut, not with the other systems, but like more, maybe it's more related to dysbiosis, I want to say.
Yeah, well, actually, I have dysbiosis.
Okay, so I think that's more because of that one, but I need to know a little bit more in order to address exactly what's going on.
Well, I hope so. I hope I can.
Okay, okay, thank you. Yes.
Thank you so much. I feel like we got all the questions in. I know we're running out of time a little bit. We have so much valuable information provided by Dr. Sarebanha, and thank you so much. I do want to let everyone know that if you did want to book a visit, a comprehensive visit with Dr. Sarebanha, she is offering a discount of $50 for initial visits for new patients who schedule from this Zoom. All you need to do is mention that you're at the Zoom call, and we will go ahead and get you all the information on what a comprehensive visit would look like for her and go over all of that. You simply need to go onto our website, niadc.com, and under her profile, you'll see an option to request a visit. You can simply request a visit. You guys all have my email as well, I believe. So you can email me if you have any follow-up questions or any questions about scheduling a visit as well. So I want to thank everyone so much for joining and taking the time out of your days. And of course, Dr. Sarebanha, again, for such valuable information and for her time. And
Thank you. Okay, thank you, everyone.
Thank you. Thank you very much.
thank you, everybody.
Bye.
Thank you.
Hey, folks, I'm going to go ahead and pause the recording if that works.